We are teeing up our second session of the COVID-19 Innovation Panel. And today's second session is Opportunities for Innovation, Startups Responding to COVID-19. So in this discussion, we will hear from two Austin founders who have launched products to address COVID, creating jobs while filling critical needs for coronavirus tests and masks. So join us today for this session. We will hear from Julia Cheek. Julia is the founder and CEO of EverlyWell. And we'll also hear from Lloyd Armbrust. Lloyd is the CEO and founder of Armbrust American. And we have Mellie Price, who is online today to be our moderator. Mellie, Executive Director at Texas Venture Labs, and she will moderate our conversation. So Mellie, I am going to hand it over to you.
Great. Thanks, Meg. Thanks to Accenture for bringing us all together for this exciting session. It's great to see you, Julia and Lloyd. It's been a while since we've seen each other in person, but nice to see you virtually.
Good to be here.
Nice to see you as well.
Great,
really happy
great background.
to be here.
10 out of 10.
COVID Innovation Panel. Well, both of these entrepreneurs they're just phenomenal as entrepreneurs, but also as humans. And I'm lucky enough to know them both. As Meg mentioned, Julia is the founder and CEO of EverlyWell, which provides, it's a consumer health testing company that provides innovative at-home kits and has transformed the way we do at-home testing. They're at the forefront of personalized medicine, and they're tackling the $25 billion diagnostics industry. Julia, correct me if I'm wrong here, but you've been at it for just about 5 years now?
Yes, just over 5 years, and came to market about 4 years ago. Right.
Yeah. Which is when I joined Del Med. And so it's really fun to be here these years later when, in full transparency, I didn't quite have the appreciation for the $25 billion industry you were tackling. I knew you were onto something interesting, but I've come to really appreciate what you're trying to do. Julie is also a partner at Next Gen Ventures and boasts the Harvard MBA title. She's one smart cookie and a fantastic entrepreneur. And then Lloyd, who I had the privilege of getting to know at Capital Factory when he was running Own Local, is the founder of Armbrust American, which is a Texas-based manufacturer of USA-made medical grade N95 and surgical masks. As mentioned, he's the CEO of Own Local, which is a technology platform that helps publishers manage their digital advertising transformations. And you've been at that one for 10 years or so, right?
Yeah, 10 years. It was a little bit longer, but when we got into Y Combinator in 2010, and we'd like to pretend that's when we started because it sounds more impressive.
Right. Well, so two entrepreneurs building awesome companies, and then boom, COVID hits. So we're going to kick off this COVID innovation session talking about, your founders running important companies in their own right. COVID hits. When did you first realize that you all wanted to and needed to participate in the response to COVID? Julia, why don't you kick it off for us?
Sure. I think, for us, it really started actually pretty early in January, where I started fielding questions from investors, from others, just my friends and network that said, are you guys going to try to get into this virus testing? And it was very early on, I think, before we were even really aware of the severity and the spread. And I just dismissed it out of hand. Like, why would we do that? What are you talking about? There's plenty of research facilities, hospitals, government laboratories, LabCorp and Quest. They are positioned to handle this and they will have it. And that is not the business that we're in. And so it was very interesting how quickly my perspective began to change as we saw the announcement of the FDA emergency use authorization, which was specifically because there was no capacity for testing in the US and they were trying to make that easier. And how then we also were ahead of the curve, understanding that home testing would be essential and non-healthcare environment testing. And so we actually ended up getting into a COVID support response through grant making in early March, and then ended up launching our very first healthcare provider COVID test on March 23rd. So quite early in the pandemic. But again, we had the infrastructure already in the platform. This is what we do. We offer national lab testing at home through a digitally integrated experience. And so while I didn't believe we had the scale to help respond in the crisis, we certainly had the platform and ability once it became clear that we could play an important role.
Mm-hmm, mm-hmm. And Lloyd, you were running, a company that works with publishers and, digital advertising. How did you get the inspiration for Armbrust and American, and what made you hit the ground running to start a manufacturing company of all things?
To be honest, I was just kind of waiting for someone else to do it. It's one of those things. And I'm sure it was very similar for you. It sounds like, Julia. It was incredible to me. I kind of grew up in a manufacturing family, so I just sort of had some basic knowledge about some of these supply chain issues. And I was telling people very early on, I was like, what are we going to do about the N95? Like, we're going to run out of those because we don't make them here. They're all made in China. And I didn't know it before, but I looked it up and I was like, it's actually Wuhan. So if Wuhan's shutting down right now, and this was like December, January, like, it's the way logistics works is going to take a really long time for those guys to catch up. So what are we going to do? And I was just like, no one's covering this. Like, I was like waiting for the daily episode to drop, about we're going to run out of, and it eventually did, but it was way, way later when it was already a crisis. And at that point in time, when people were talking about it, I had already done the research and was looking into it. And I just remember every entrepreneur's solution in Silicon Valley, every one of my investors who were wanting to help, their solution was, oh, I have some contacts in China. I'll figure out how to sneak out some masks. I'll figure out how to sneak out some PPE. And I'm like, guys, why don't we in a way, this whole system is a virus in a way. It was a problem that we have in our country with manufacturing. And the only way to solve the virus permanently is if we can actually build this stuff here so that this will never happen again. And it also turns out a lot of things are happening with manufacturing where automation is so much faster. With vertical integration, we can bring the costs way down. So if you put all those things together, I'm a big financial geek. And so I put it all together in a model and I was like, the numbers make sense. We can make it cheaper here than it can be made in China. And so that's when I was like, I think it was actually probably April before, or maybe it was March before we actually pulled the trigger on, I remember, writing the first $500,000 check. And we've raised about $5 million very, very quickly in about a weekend. But that sort of timeline it was literally the same thing as you, Julie. I was just waiting for someone else to do it. I was like, surely 3M, they're going to triple their capacity. And they're like, oh yeah, we're doubling our capacity in China. I'm like, well, that doesn't help, guys. We need to do it here. Yeah.
So, this I could talk to you both forever about what happened historically in the 6 months where we've all transformed our businesses. And, Lloyd, to your point, I had that same experience. Julia, you mentioned friends started calling, right? That first week in March or so, where those of us in the industry knew that this was coming quite early. And then we started getting calls and we start knowing people who are getting impacted. Lloyd, it was really powerful and disturbing how I had friends who worked at nursing homes trying to get their hands on N95s, and just that early trauma of how do we respond as a community to keep our own people safe and keep our loved ones safe who are more at risk. And so on my side at Dell Medical School and in the UT ecosystem, I saw the IRB process for approving research protocols get expedited in a way that I don't think anybody even thought was possible. So some transformation was lightning fast. Some of it was painfully slow. Like, really? It's going to take you 6 months to ramp up and double your capacity? Like, why can't I get Clorox wipes? Is it that hard? And so I'm curious to hear from you all, what were the obstacles that were in your way in those early stages? Which of them are still here, right, 6 months later? And what were the things that just obstacles that vaporized because we had things like emergency use authorization? Because you both have different products, and in terms of entrepreneurs thinking about continued innovation, I think it'd be helpful to talk about a little bit about what we've learned about the regulatory process, the the supply chain process, et cetera. So Lloyd, I'll kick this one to you since you deal so much with the supply chain process. What did you bump into?
Everything, it's everything's backed up. Behind me, this is our factory, and we've been working on this air shower entry system, which is behind me. It'll look really cool later, I promise. And just getting the parts for that have taken 3 or 4 months because everything's so backed up. But I think that what I was looking for when I was trying to do this is I put together a model and I was like,
Hey, good afternoon, everyone. We are so sorry. We are experiencing a little bit of a technical difficulty. Nothing to worry about. We're just going to keep going. So give us a sec to work through some of these issues. As you know, it has been such a challenge, and I think such an opportunity too for us to recognize new ways of working, and we're all working from home. And sometimes things happen. Sometimes we run into technical difficulties. So we're just going to roll with it. I see we've got Mellie back. Mellie, thank you so much. We've got Julia as well. And I think we're just waiting on Lloyd. And then we can go ahead and get back started with the panel. Thank you all.
Awesome.
Thanks, man.
Hi. Great.
Hello.
I'm happy to continue the conversation with Julia while we're catching up.
Great.
Absolutely. I was really enjoying that. Absolutely.
I'm not sure if I'm happy it was everyone, but I felt really bad when I thought it was just my tech. So I was like, oh no, it's my internet. So anyway, I'm happy just to do you want to reframe the question, Mellie, really quickly, and then happy to comment?
Assuming we all got kicked off at the same time, my question was really about, in those early days, what blockers got removed for you that allowed you to move quickly, and what things are you still touching on now that are keeping you from being able to move quickly? Obviously, your space is highly regulated, so I can only imagine you've dealt with your share of issues.
Right. And, highly regulated, but also moving at an unprecedented pace, a little bit like you mentioned the IRB, Mellie, and your experience with that. And so I think what, unfortunately, the American public became deeply familiar with that we experience every day at EverlyWell is actually the physical supply chain of lab testing. So you think about it when you think about manufacturing of PPE, but we faced, I will tell you, every step along the way, we were ahead of the curve in knowing what the next shortage was going to be. And then 5 days later, I'd see Bloomberg write an article about it. For example, swabs. Swabs were on global shortage. We ended up amassing a fairly large quantity to be able to ship out to frontline providers in those early weeks of March, and we served over 30,000 frontline workers to get people tested by third week of March. And we were able to do that because we were ahead. We were able to understand where the gaps were going to be and just move faster than everyone else. We actually had T-shirts made that said Swab King because it was about when the Tiger King drama came out and our whole team was chasing down these swabs. And so that was one piece, but it just kept shifting in the testing infrastructure from one limitation to the next. So swabs to reagents, to platforms, to logistics, to shipping. And so what we've known for 5 years, which is that the testing infrastructure was deeply under-optimized and underinvested in, unfortunately became very, very clear. Now, what did get sped up for us is a couple of things. One, there have been tremendous legislative changes overnight in areas like telehealth, cross-border physician practicing, things that really did not need to exist in regulations that were preventing affordable and accessible virtual care for Americans that have now gone by the wayside, which has been a great silver lining. The other thing has been FDA authorization. So EverlyWell as a digital health company didn't have a way to get the FDA's engagement prior to this. We had other regulators that we worked with for testing. And now our platform is emergency use authorized end to end, including the digital piece of it, which is a major improvement. But it's something where that really accelerated in a way for us where it could have been years before we had that opportunity to work and partner with the FDA in this way.
Mm-hmm. Yeah, so many layers to that response. Welcome back, Lloyd. It wasn't just your technology; we all disappeared. So, really, and when we got back on, we'll get back
all of us. Wow.
Yes.
You bring up a bunch of layers in that comment around the role of policy in the ability for legislative changes to fundamentally change the game. And you mentioned that these changes unlocked more access to care than ever before. And so as we're heading into this really charged election season, right, I'm curious to hear from both of you, what do you think are bipartisan measures, are things that we could be doing to use this opportunity to provide greater care and greater access to care and greater PPE and greater testing to all Americans? A little bit of a loaded question, I recognize it, but I think it's important when we're talking about health equity. So what are your organizations doing in the legislative space, or what would you like to see happen in the legislative space?
Go ahead, Lloyd.
Oh, sorry. It's very interesting. I think that government can be a huge hindrance, as you were talking about, Julia, as I caught the end of that, or it can be a huge help. And I think that when it comes to healthcare in general, and when it comes to companies making medical devices or tests like you, I think that these sort of incumbents that have been around for a long time, these billion-dollar companies, they're kind of like the record labels, if you will. If you wanted to get into music, it's like you just had to get lucky with the record labels. It's kind of like that because it's so hard. Like, you have to be willing, which apparently you were, to work for 4 years without a product that's viable that you can launch. And most people aren't willing to do that. Most people are uncomfortable with that risk, especially now when I could start an e-commerce startup, right, and start selling whatever. And right now, today, and I'd be selling tomorrow. Like, why would I go and take this big bite of a huge problem that EverlyWell has done when there's just so much easier things to go after? And I think if you look at Y Combinator's pitches as an example, I've noticed that it's just, they've gotten really, really specific on really niche web products, but they're not tackling these problems like you're talking about, Mellie. And I think that is the shift that we're going to see in general, whether that's like in regulation. We've seen the FDA move so fast with some of this stuff. And I know that they've gotten a taste for this is what it could be when we start bringing more resources to the table, when we start bringing these more agile companies to the table. What it's going to end up hurting is the incumbents, the people who, these large giants, these 3Ms, these pharmaceutical companies, these people that want to really maintain the status quo because they have billions of dollars at stake. But what it's going to help, I think, is the everyday person. When you are able, and it's the same. And what this is just the internet working again. Because what the internet does is it eliminates the middleman. Whether that's in communication, whether that's in every facet. This actually is in the health sciences and in healthcare. This is one area that it hasn't happened. And I think that COVID-19 has really exposed that to a lot of people and given opportunities to folks to be successful in that in a smaller way.
And Lloyd, you chose to go direct to consumer. I think I saw publicly that you all see contracts with Illinois and some state level things. So was that a legislative opportunity that allowed the procurement process to move more quickly? And are you benefiting from that in any way now?
That's a great question. So we actually built the whole business model on enterprise sales, because that was my background, was doing these big hairy deals with big companies, big billion-dollar companies. And so state governments, hospitals, institutions, that's how we built the model. And it was funny because you mentioned you had relatives in nursing homes, Mellie. It was literally the morning of our launch back in May, I think. I was it was 2 hours before we were launching, and we were very lucky to have about 5 news articles lined up that were going to go live at the same time. And I was like, you know what? I was like, what? It's going to be hard for that average person in Austin, that average person in New York today to get it. You could go to the store and you couldn't buy masks. That was a thing back then. Now the supply chain has sort of caught up, but at the time that wasn't a thing. And I was like, you know what? I'm going to do direct to consumer. There wasn't a big plan around it, honestly. It was more like, this needs to be in the hands of people. And I literally spent probably 45 minutes before we launched setting up our Shopify store, which huge testament to how amazing that software is. And we launched, and in that first week, we did 1.4 million orders. I had no idea that consumer would be such a big part of our business. And what's been so great about it is consumers, like, unlike enterprise is forgiving. Like if you're like, oh, I need an extra week on this, they're like, okay, I understand, because they want to build the relationship. Consumers don't care. And so we got railed in our reviews and all these things because we weren't shipping fast enough and all these, but that forced us to be such a better company early on or die. And so it's actually been really good for us. It's been a really great forcing function for us. But I'm seeing more and more things that should go that way. And again, it's like,
well, Julia's company should go that way, right?
Middleman.
They're pretty much as direct to consumer.
Yeah.
And I'm sure you had a whole bunch of inquiries about, I need COVID tests now.
Yeah.
It's such an astute comment, because so much of healthcare innovation is digital consumer engagement.
Yeah.
And my first question to any company in the healthcare space that claims to be consumer oriented or patient oriented is, how much of your revenue comes from consumers? Because unless you are paying for the experience with your dollar, you are not a consumer focused business, and consumers have a very high bar for expectations when they're paying you money. And now we are 50% enterprise, 50% consumer. But the reason we are that way is because we have such a superb high bar for how we deliver our service, because we have to, or we die. And you know, I think that that's a real necessity around innovation in healthcare in this new world, is not claiming to be consumer focused, but actually seeing if consumers will pay for your services. It's just like product market fit in any other consumer branded business, except for some reason in healthcare, people have gotten away for decades for claiming to be patient oriented, but not actually engaging with the patient for value.
Yep. Yeah. That's a great point. Well, you know, the issue of the pandemic and the course that it's taken, it obviously has been highly politicized. And you know, this is a track about driving further innovation. Most folks say COVID's not going anywhere. At this point, we don't really know the long-term immunological consequence. So I think testing is here to stay. I think the needs for masks, whether it's COVID or a strain of flu, I mean, this is now on our radar as something that can really change the course of our lives. So, and the course of our economy and our businesses. So how do you think healthcare has been changed as a function of the pandemic? I mean, we've touched on telehealth and some access to healthcare, but what else has changed for you all and for your businesses? Julia.
I mean, you know, I think, as I said, there are some silver linings around the virtual care unlock. Fortunately for EverlyWell, and frankly, unfortunately for the rest of the country, people have gotten a view into the brokenness of testing and who it serves, which is the insurance companies today, and how much we need to transform that, as diagnostics are just such a critical part of our healthcare experience overall for people. But, you know, a little bit on the negative side, I have seen an unfortunate and massive distrust around doctors and science that perhaps was seeded before the pandemic, but has only been further entrenched. And even around, particularly as we go into this next phase around vaccinations. And so I am deeply concerned. And as I think about innovation, I think it needs to be innovation at the community level, innovation at the education level, really understanding how to create belief and trust in the system again, because that is actually what's going to be essential for overcoming the pandemic, is trusting the experts and having consistent information.
Yeah, and we've experienced a lot of damage.
Absolutely.
You know, on both sides, quite frankly. I don't think that's. So we've got just a few minutes more, and we do have some audience questions. Audience, we're going to start opening it up to Q&A from the audience. For y'all to fill us out with great questions. My last question is really for both of you. What opportunities do you see next as a result of COVID, or as a result of this new world order that we seem to be living in? Lloyd, I'll let you take us across the finish line on this one.
Great. Yeah. I think it's obvious. I think it's just really opened up people's eyes to the complexity of supply chain. Like the average person is like, wait,
you need
it's hard to get toilet paper. You know, it's like, wait, but toilet paper, like that's hard to, like, why is it hard? Like, I think people just kind of take it for granted that things just are there on the grocery store shelves. And so I think that is going to have an incredible boom for the future of manufacturing in America. And I think it could not come at a better time, because we need more opportunities for jobs than we've ever needed before. There's a lot of things that technology has done to remove jobs, right? If you think about like the next big thing that's happening is if the one job that you can get paid really well and not have a high school or college education is being a truck driver. And that's going to go away when self-driving cars happen. So you're going to have 10 million people. And then all the cottage industries around that, like gas stations and all those things that just don't need to exist anymore. All that infrastructure is going to go away. Who's going to give those people jobs? Like, I really think bringing a lot of that manufacturing back here, but then also bringing the human standards, the environmental standards, and all the things that you have to do to be just a business in the United States, along with it, is going to make the world a better place. Because right now, I'll use masks as an example. So we make, millions of masks here in our factory. And what we do that's different is we start from raw polypropylene, which is just a plastics. Now, the best polypropylene in the world is actually made here in the United States. And so what China does, or the best companies do, is they buy the polypropylene that's made here in the United States, they put it on a boat, they bring it all the way to China, they make them, they turn it into fabric, they take that fabric, they press it into masks, they put it into boxes, and then they boat it way back here. Do you know that like boats are, that ocean freight is responsible for 17 or 18% of global emissions? That's insane. We're just like boating stuff back and forth for no reason. With automation and with vertical integration, we can make all that stuff here cheaper with less people in a more efficient way. And I had two conversations today. Somebody coming to me and say like, "Hey, Lloyd, do you think we can make this here?" And I'm like, "Absolutely, we can." And I think that is going to be the big boom, is that the American public, which is the biggest consumer market, is now just awake to that supply chain problem. And the second thing I'll just say real quick is that, again, back to the internet, removing the middleman. Manufacturers don't sell directly to consumers, not in the United States. They don't do that. They don't know how. But that's going to change. And when that changes, that's making things so much more efficient. So now when you eliminate that boat problem, which is a cost to the consumer, you talk about automation, right? Which is eliminating labor, which is eliminating cost to the consumer. And now you eliminate the middleman in these processes, and you can buy stuff directly from that manufacturer and get to know that manufacturer. I think you can actually make things cheaper here than you're getting in China once we get the supply chain logistics of that figured out. So I think that's the biggest boom that you're going to see in the next 10 years. I think it's going to be bigger than the tech boom, to be honest.
Yeah, manufacturing boom, a stateside manufacturing boom. Yeah. Well, reagents, I mean, gosh, so that's what I remember in the beginning of March. It was like, well, there's 70 some odd tests out there, and you can only get certain batches because you can only get certain reagents. And yeah, so Julia, you want to finish?
Dumb problem to have. It's a dumb problem to have.
Yeah, and it's also, by the way, a lot of these reagents for other types of testing are still on allocation. And so to be clear, we are not out of the woods. And if we think about the implications for broader healthcare condition management beyond COVID, there's been a run on many types of medical testing components, which impact other parts of testing as well. So something to look out for. Yeah, I mean, I think what will change more broadly, I do think that, everyone says things are going to go back. I think how we think about building the workforce of the future is something I'm spending a lot of time on for a couple of reasons. And we're at Austin Startup Week, but I'm looking at national hiring models specifically because I can improve my level of talent, my cost of labor, and my diversity, inclusion, and equity goals. And so as I think about talent hiring and how we shift, I mean, our headquarters will always be in Austin, but Austin is losing a little bit of that lifestyle and cost advantage because you see so much influx here from the Bay Area that now models like us are looking at how can we think differently about the workforce of the future now that these shackles around in person have been a little bit broken. And of course, there's importance of in person, but I think that will be a really interesting globalization of the talent market, even though, Lloyd, I do agree that from a manufacturing and physical jobs description, I think a lot of that will come more national. And so I think you'll see a reverse of the in-person sort of hubs around work and the shifting there. Yeah.
All right, we're going to get to some audience questions. I have a couple of targeted questions towards each of you. Lloyd, this one's for you. A viewer says they're working with a national hospital system interested in buying American because they've been burned by so much fraudulent PPE activity. And so the question is, you know, what are you forecasting for a big available production in the next year? How does that compare to the global market? And very specifically, what is 3M's annual production of N95s? And so I think they're looking for sort of a, where does Armbrust American live in, you know, the total available market of what's going on in the PPE space?
Yeah, it's a great question. So 3M, I'll do it kind of reverse order. 3M has about, they've increased their capacity by, I think about 3 billion is the number, if I'm correct on that. You have to fact check me on it. We've actually seen the same thing. So we're talking to a lot of hospital groups who are coming to us and saying 30% of our PPE has to be sourced in the United States. And I'm like, that's great. I love that. That's awesome. Where are you going to get it from? Because granted, we're making, you know, these masks, but we're not making all the other things that you need to make. And it just isn't here. It just literally does not exist here. So it makes sense they got burned and they want to fix that, but there's just not the capacity for it yet. So I like it because I think that's going to incentivize, you know, more manufacturing companies like us to spin up. And to talk about our capacity, we just opened a crowdfunding round today, and we've raised $5 million before. We're going to be raising $10 million. With that $10 million, our goal is to get to that billion mask annual capacity, which we think we can get with that next $10 million. And so we just took an additional 30,000 square feet to do that. And that's kind of where we're at with our current machines. You know, it really depends on the number of shifts that we're running, but you know, we're in the like probably about 10 million a month right now. But if we were running a full shift, we could just get under 1 million a day.
Wow, that's impressive in a very short period of time for someone. I know you come from a manufacturing family, but last I checked, you hadn't run a manufacturing company. No. So no. Big steep learning curve there.
Big time. Big time.
There's a few questions for you around, you know, like what were these early indicators of supply chain deficiency? Like, did you have orders you couldn't fulfill? And is that problem being solved? You just kind of insinuated that it's getting worse, not better. How do you deal with that as a business? How do you deal with the supply chain challenge of getting the product that you need to deliver, especially these other tests that you're delivering for folks as well, not just COVID?
Yeah, I think we were ahead of a lot of the players. And so that's how we had early indicators. I'll give you a great example. One of the very first labs that's gotten a big name through this COVID pandemic out of Kentucky that had the emergency use authorization was a partner of ours named Gravity Diagnostics. They were one of the first in the country to receive the rapid platform from Abbott that could conduct 50,000 tests a day. Do you know how many cartridges they received? Less than 100.
Wow.
So you have this very broken, like you can't provide the platform from the government without the cartridges to conduct the high capacity testing. And so we saw very early on, and we even had our labs telling us, right? They were saying, look, we're out of swabs, all these kind of things. And so we started parsing together from different FDA approved manufacturers. We had people emailing us offering to pay, I mean, which we wouldn't have taken anyway, but like, you know, multiples of what these swabs are worth. And so that was really how, if you talk to the people on the ground, the people doing the work knew. And, you know, it's similar, honestly, when you would hear our legislators announce that COVID testing was free, and everybody on the ground would say, well, I wonder who's paying for it. Like that was not the case, right? And so you saw these complete breakdowns of what was actually happening from frontline providers. I know. And so, you know, and then of course we're kind of trying to educate consumers around, well, it's not actually free, all those kind of things. And so if you talk to the people doing the work, it's pretty easy to get a read on it. And we were out ahead of it a little bit. And that's how we were solving for it. And now I think, you know, there's been a lot of talk around what will happen over the next even couple of years around other types of conditions. So whether that's STI testing, for example, there is a swab that's common for STI testing that is now, there's a run on it. more broadly for virus testing, for flu, et cetera. And so I think you will see some of these other really severe conditions, infections, otherwise, other types of epidemics get worse before they get better. And we're staying ahead of that as much as we can, but things are on federal allocation. And what that means is we get in line behind everyone else. And it's a little bit of the question of how do you think about private sector manufacturing versus, federal emergency funds. And look, there's not a right answer here. There's an important role for each to play. But these private companies like us get caught up in this, even the large players like Thermo Fisher and others. So it's not an easy problem to solve. And you have to have people that are very dogged, that are just literally trying to solve this day in and day out with different providers and piece together the supply that we need.
Well, and I'm hopeful that that's where entrepreneurship can really thrive, right? It makes it extremely difficult to plan a business at scale when you don't know if you can get access to fundamentals.
Absolutely.
And we're more nimble as companies, right? And so, I'm super hopeful that innovation writ large, and I'd like to end the conversation by, reminding us, like, you were running perfectly awesome businesses before COVID hit. And COVID has been in the forefront of our minds now as business people, as humans, for months and months and months. But we still have core businesses. And so I think the companies that survive long-term and that really contribute to solving the problem have an integrated play. So I want to leave this conversation by saying, what are you excited about? What are the things on the horizon for your businesses? Where do you see the opportunity continuing beyond COVID? Lloyd, you want to go first? And then Julia, you can wrap us up.
Sure. For me, I'm just, after building digital product for so long, I am just so excited to build real things. Like it is. It's kind of lame in a way, because it's like, oh, you're just making like this mask or whatever. But like it is just so rewarding at the end of the day. I mean, it took us a month to iterate on the nose wire design to add a new, thicker, better nose wire that seals. But it's so rewarding to see that come together, right? And for me, it's like, what else can we build next? One of the reasons why we bought the not just the machines that put it together, but we bought the fabric machines too, so we can make spun bond and melt blown. We can make a lot of other stuff with that, right? Like one of the things that I'm really excited about is maybe getting into air filtration, right? And building on-demand air filters and things like that, all made with the same materials. So I'm really excited for, once this is no longer like I have to run, 3 shifts to get as many of these out the door, what can we build next that is actually like really exciting and interesting? And it's not an emergency, right? Like, and it's not something we have to do at the last minute. So I love that this has given me the excuse to actually build something real.
Yeah. Great. Julia.
Yeah. And I think for me, very similarly, it's been really rewarding to watch. We actually do run a lab, not for COVID testing, but we run a lab out of Dallas, Texas, that has over 60 employees that have worked through the pandemic. Wow. And our business is up over 100% year over year without COVID. Actually closer to 150%. And so I think as we look at how important testing really is in the home, in people's hands for really important conditions like STI testing, colon cancer screening, et cetera, we have a core mission that we're still just feel like we're scratching the tip of the iceberg. COVID has afforded us an opportunity to show people what that platform and that mission is in a different way. But we have been really, really focused on that core mission as it is. I mean, just the whole reason we integrated our own lab and opened it in March. What a time, by the way, to open a lab, and opened it in March, was because we knew that we could lower prices to our consumers. So like in the last 2 weeks, we just launched 2 monthly plans for STI testing and then broader testing, like half of our tests, at $15 a month and $25 a month, respectively. And it includes treatment. You cannot find a more affordable and innovative model than that for some of these types of tests. And so I'm just excited that I think we've really been able to do, never waste a good crisis. We've been able to do so much in 6 months for our product that probably would have taken us years.
Yeah.
And it is unfortunate that this is the platform for testing to take the forefront, but it is an opportunity for EverlyWell, and one that we take very seriously to step up to the occasion.
Julia, I found out that with the tech problems, we have a few more minutes, and there's been several questions that I think folks are really eager to understand, specifically related to at-home testing for COVID. Can you share, have you cracked the home market, and what's the status on COVID-19 testing?
Yeah. So we were still the first and only digital health company to receive the full end-to-end EUA from the FDA on May 16th. LabCorp did receive an amendment to their original EUA for an at-home collection test about 2 weeks before us. There's 6 total on the market. The NPS for our all FDA authorized. You cannot offer an at-home test that's not specifically under an EUA. There's a process with the FDA. I know more about this than anyone ever cares to know, so I will curtail my comments. But there's a process with the FDA by which you can submit your EUA and begin operating under the filing of your EUA without it being reviewed and approved. That is not the case with at-home testing. There are several companies who have tried to do that who have gotten shut down.
Yep.
So we had to wait for an express authorization, as did the rest of our labs, before we moved into the home. We were offering approved testing through healthcare providers before that. So with that model, our NPS on our at-home COVID test is a 75. It's cash pay or reimbursable. And then we have a very large enterprise business, including very large logo health insurance clients, employers, et cetera, who are also now doing other types of projects with us, like testing. We actually have a research product as well with UT Health. So I think that is the status of the at-home market. What is not approved yet, which this might be referring to, is a rapid antigen test outside of a healthcare provider setting. We are hoping to be first to market with that. Can't say much else. And we'll see. I do believe it will probably be January before you see a rapid antigen platform get approved for what I would call over-the-counter at-home self-collection. And that will be the path forward. Frequent, high-count rapid tests alongside confirmatory PCR.
Yeah, there's also been a lot of questions about this. A lot of people are now offering saliva-based testing. And so I think there's just so much darn confusion about testing. I get to work with Dr. Esther Malamed at UT, who's a neuroimmunologist working on a 2-year longitudinal study about how the body responds over time. And people don't realize, it's not just like you take an antigen test and that's the way it is forevermore. Like the body is a living, breathing organism that changes how it responds in the presence of these things that you're testing for. And so dialing in the sensitivity and specificity, right? There was so much confusion early on and there was a lot of press releases of we got EUA approval and then the test disappeared, right? And so I think the market is hungry for an organization that's like if I'm a mid-sized company, I want to be able to call and say, I had a positive outbreak.
Yep.
What do I do? And the buses pull up and they test and they, and it's the right test at the right time at the right place. That clarity is lacking. So I'm really
we have to have people obviously here making masks. And so we've had a couple of kind of close calls where not anybody here, but people who, husbands and wives and stuff have had it. And so then we do like the contact tracing type thing here. And so we have to send everybody that has been around that person, like to a lab, to like an urgent care to get tested proactively, because that's what we have to, because obviously we can't have an outbreak here. And if we had some sort of test like that, the dollar amount.
Lloyd, we should talk because we support a lot of manufacturing businesses.
Yeah.
So, but it's interesting because you see all these press releases, even the Abbott rapid antigen test that the federal government bought up. The mileage between an approval and a commercialization on the market is like the Grand Canyon. So an approval does not then mean suddenly it's in everybody's hands, right? And I think that's what people are also feeling is you have these great products, these great scientists, and yet the actual commercialization of the test and getting it into people's hands and into the right places has been challenging as well, and has caused delays.
Yeah. Well, Lloyd, I think your construction has commenced. I heard that going on, so I won't put you on the spot here. But the questions are coming in. Julia, the comment about the push to remote work and thinking about your national hiring model. Do you see more or less value working with a staffing agency or managed service provider helping to attract and retain new models? So as you're making this national push, are you relying on those same old, ways of finding people?
Yeah, well, EverlyWell so we had 60 people in March. We now have over 250.
Wow.
I hired my HR leader 3 months ago, who then hired a recruiter. I mean, it's just hyper scale. And so I don't even know if I have an answer that would be realistic. Like there's no strategy per se, and I'm not taking that lightly. It's just, we're trying to find great people and bring them on board, and it's a little bit of the model right now. And I think we will start to get our sea legs under us a bit and have an actual model. But at the moment, my team has worked really hard. They were 24/7 for at least 4 months. So right now we're just focusing on getting people some support and then going from there. So,
yeah. And Lloyd, how are you? You're growing like a weed too. How are you all finding people for manufacturing jobs? I mean, do you have to do much skills retraining? Or, the opportunity for people who are out of work to find work in organizations like yours is fantastic for, our ecosystem. What are you doing to find your manufacturing help?
Actually, Julia touched on it earlier about how it's amazing to give people opportunity in this time. And that's one of the things that has been amazing to me. We had just from the service industry, like we had a lot of folks who were in, waiters, waitresses, nail salons, that sort of thing. And people who we basically take an aptitude test, and they're making twice as much or 3 times as much or more than they were before in something that we've trained them. And that's why I really think that manufacturing in the United States is the future, because you can take somebody and give them more than a living wage. Here, working, making something with their hands, basically assisting a robot, if you will, doing their job. And you don't need any college education for that. You don't need anything. I mean, we train on the job in 2 to 3 weeks. So we have, I actually don't know how many people we have. I asked the other day, and my HR person said, or we were doing an insurance evaluation. They were saying, oh yeah, we have like 88 people. And I was like, we have 88 people? I was like, that's insane to me. So it's been crazy. And it's been actually the hardest part of our growth, to be honest, because we do have to train and we do have to and there is a big lag, and we do have a lot of people don't make it, about 50% don't. But the most rewarding thing for me is finding those people who used to work at a nail salon. And now I have this one girl who is running a shift, and she's one of our best operators. And it's so fulfilling to me to see that, to give people that opportunity.
Yeah. Well, we're getting the 1 minute warning. We could talk on and on about this. I think there's so many opportunities that COVID has opened up for innovation writ large. And I can't wait to see how we respond after we're out of this shock.
The one thing I would say is I just love the framing of this, like COVID opportunity. So many people saw this happen and they're like, well, everything's over. I guess I'm watching Netflix now. And it's the people that are like, no, this is a once in a lifetime opportunity to change things for the better.
I agree.
And that's what people who are watching this, that's why they're watching this, because that's what they're out there. They're doing those things. And I just want to say, that's the spirit I love about America. And that's the thing that I want to encourage. So I appreciate the framing, the positive framing of the opportunity.
I couldn't agree more. I launched the last company out of the 2001 recession, and we have an oyster opportunity here, once in a lifetime opportunity. So thank you to you both. I wish you both in your next chapters of your businesses. And thanks for giving us your time and expertise today. Keep fighting the good fight. Thanks, Meg.
Thanks for having us.
Absolutely. Thank you for that great conversation. That was really, really fantastic. I loved Julia hearing you talking about being the swab king. That was fantastic. And really learning how to create trust in the system again. And then your commentary about the workforce of the future. You know, I hear so many of our clients talking about really breaking down those barriers around remote work and how the pandemic has opened up doors. So thank you, Julia, Lloyd, and Mellie for that really great conversation. We are now going to transition over to networking and hop in. So to network with other attendees, and again, I really encourage everyone to take advantage of this. This is a great opportunity that the folks behind Austin Startup Week have brought to us. So just press the networking icon on the left-hand side of your screen. You will then be randomly paired with another attendee. You will have 5 minutes to chat with one another. And if you'd like to continue your conversation, you can simply click the connect button, and you will both receive an email from Hopin that will let you connect with each other later. So we only have, unfortunately, 5 minutes for networking, but great conversation. I'm glad we were able to extend it. We will go ahead and start our third session right at 2:45 p.m. So we will see you back then.